Let's face it, these days, in this day and age, we all trying to figure out a quicker way to get to the bag. But is getting to that bag as quickly as we do or as quickly as we can affecting our health? I want to jump into this topic, so stay tuned.
Because anybody can look good when things are going good. Don't tell me how much man you are, how much woman you are when everything is perfect. You're fake. I want to know how bad you are when you're under trial.
Hey, what's up, y'all? It's AWTM, and I have something to talk about. Now, a lot of people in our society are trying to make sure they are financially stable. They want to be able to travel and do things. They want to be able to have the material possessions that they want to and live a certain life. Now, this leads a lot of younger and older individuals to go ahead and go into the healthcare field as a nurse or a caregiver in some form or capacity. But my concern is that people that go into this field, they have to have a certain level of compassion for other people. They have to have empathy, and you have to have a lot of patience. If you go into this kind of position just expecting a check or just wanting to get paid, you're not going to take another person's feelings, their care, and everything so seriously. Handling the frustration that you may feel as a caregiver because you don't want to do something for that person, like maybe clean them up or give them certain medications or just listen to them and their needs, this could become detrimental. There was a story about a young lady that actually didn't want to change one of her elderly patients, and she beat the lady up and then smeared the soiled diaper in her face, which was terrible. Now, people that are sick, disabled, or elderly, they are in a vulnerable position. And if you ever been like sick one time to where you really couldn't take care of yourself, you would understand that. With this being said, I think that there needs to be a more thorough background check before you go into this kind of field. Maybe some psychological evaluation, maybe some empathy and compassion training for these individuals, because that could have been your loved one that's being mistreated. That could be you that is mistreated when you're in the hospital. I've noticed, throughout time, at different times in my life that I may have had to stay in the hospital for a day or two, that some nurses care about you. They care about their job. They want to make sure you're okay. And some of them have the attitude of, I'm here to do a job. Don't get on my nerves. Don't do too much. And that is totally the wrong attitude to have when you're in that field. So before you consider going into the medical field as a nurse or as a caretaker, make sure that you have compassion, make sure that you have empathy, make sure that you have patience. If not, it may be better for you to consider an administrative position. It's a given in life that we sometimes can get overwhelmed and frustrated in different situations, but when you're doing something like caring for the health of others and their safety, there needs to be a little more patience there. And if you're frustrated, you may need to take a break or a step away. So that's all I have on that subject. Let me know what you think in the comments. Be sure to like, share, subscribe, follow. This has been AWTM, and I'll see y'all next time. Child, now I don't know what they was thinking about. Everybody's so messy. AWTM with the news you can use. TV shows, and your latest celebrity news. Follow me on Facebook, Elise, YouTube, AWTM, TikTok, Elise with the message. Now let's get into